like to welcome you all to the talk that we have tonight. We're ready for you. We've got two very great speakers. We have Dr. Adair, who is an orthopedic surgeon at the Springfield Clinic. He's also our orthopedic medical director for Memorial's Orthopedic Services. Then we have Dr. Saleh, who is an orthopedic surgeon at SIU School of Medicine. And what's going to be a little bit unique about his talk tonight, he has a lot of education and experience as a surgeon. However, he's going to also give the perspective as a patient, as he's been a recent hip replacement patient himself. So he's able to offer that unique perspective of both the surgeon and the patient. Before we start, though, I'd like to tell you just a couple of things about Memorial's Joint Works program for hip and knee replacement. We have been in existence for almost 12 years now. During that time, we have completed over 13,000 hip and knee replacement surgeries. So this is a very common procedure that we have done. It's still a very major operation. It's a big deal. So I'm glad you guys are here to learn more about it. It'll be very helpful for you if down the road you decide to have a total joint replacement. We do a lot of behind-the-scenes work that you wouldn't always see. I know that when I've been a nurse at Memorial for about 23, 24 years now, 20 of that in orthopedics itself. And I used to take care of the patients, and then I did the education for people prior to their joint replacement, but now my role is all behind the scenes. We're taking great care to make sure that all of the outcomes that you expect are happening. So we do a lot of data collection, a lot of managing outcomes. We want to make sure that you're getting the results that you need after you go through this big deal surgery. So we participate in what's called the American Joint Replacement Registry. That's something that we started, we were right out of the bat, and we jumped into that right away. They now have hospitals participating in all 50 states. So it's good. It's going to really take off. They're going to have a lot more participants before it's all said and done. But that makes sure that everybody's on the same track, no matter if you have your joint here, if you have it in California, if you have it in New York. Everything is going to be done with your best interest in mind. We're also certified in hip and knee replacement by the Joint Commission. That's kind of a nice honor as well. We do things like that around here at Memorial, but not for the award, just to make sure that we are on the right track, making sure we're doing everything that we can in your best interest. So, if you have questions as we go on this today, you're welcome to just ask. It is a very informal presentation. Bathrooms are located around that wall right over there. Help yourself to the water if you haven't done so already. And I'd like to go ahead and introduce Dr. Adair to go ahead and get started.
Well, thanks guys. Jennifer, if you don't know her, you probably will or you should. She does a fabulous job. And she's kind of the one behind the scenes doing all the work to get the registry running, looking at our pain scores, looking at our outcomes, getting things from A to B, and she's kind of overall our little guardian angel that kind of makes sure we're always on track. Well, I'm not going to give you a big talk tonight on what kind of joint you need or what the advantages of this or that are. I think Dr. Saleh and I will probably tell you that most of them aren't terribly different. Probably the biggest thing I notice is you guys are probably in charge of your outcome as much as anything. So that's what I'm going to focus on, because that's what you guys can control. You can't control what Dr. Saleh or I do. You can't control what Memorial does too much, but you can control what you do. So that's kind of important, and that really certainly may make a difference. It's totally different than it used to be. When I first started this a lot of years ago, people stayed in the hospital 14 days. They come in 2 or 3 days before, we work them up, we get all the lab work, we do all the stuff, they get their surgery, they lay around for 2 weeks, and then eventually they go home. So now most people are there 2 or 3 days. So things are working, things are quicker, and things are markedly better. So I kind of look at this as a little bit of a roadmap on how you want to go through this. If you are thinking about a joint, you need to prepare, you need to pack. What do you need to bring? What do you need to do to get ready for this? And what you do for this does and can, will make a difference. At Memorial, there will be, it's a huge number, there are 70 healthcare professionals that will probably touch you on your way through on your 2 or 3 days. So what we do is have a pretty highly intense, highly sophisticated machine going on here, which works very well the vast majority of the times, but it is a complicated machine we've got. You're not la-di-da around for 14 days in the hospital. Everything goes boom, boom, boom. And the better you're prepared for it, and the better you know what's going on, and you're expecting all this, the better off you'll be in the long run. So, and this doesn't probably just apply to knee replacements, but the one thing I think it's really kind of key is if you think about this, if you look at people who have had a knee replacement versus people who have not with degenerative arthritis, if you look 7 years later, the risk of dying for any reason was 50% lower for the people that chose to get a knee replacement. Well, why is that?
They're more active.
They're doing stuff. They're not sitting around waiting to, you know what. So they are active, they're able to do stuff. So in some ways, this is a way to get your health back. This is something that you may go, you know what, I'm not getting around, I'm not doing my thing anymore, I'm getting old, I'm getting crotchety, my bones are going, my muscles are going, everything's going. So what do I do? Well, this may be a good thing for you to do. And the other thing, and you don't have to read this, but let me just tell you what it says. This is basically a cool study that talks about people physically active versus physically inactive. And there's a whole bunch of things over here, none of which I want. Arthritis, back pain, cancer, diabetes, heart disease, hypertension, lung disease, psychiatric problems, stroke, blah, blah, blah. Bad things. And if you look at the people who are physically active, they have less. Then the physically inactive people have more. Well, which one do you want to be in? Nobody wants any of that stuff. Not that you can prevent it, but you can lower your chances of it. So for you to decide that you want a total joint may be a good decision for you. You may live longer and you may live better. So the only person you're destined to become is the person you decide to be. I kind of like this quote. This is Ralph Waldo Emerson, but a lot of this is up to you guys. If you guys want this to work, if you want to do this, you do it. None of us can make you do this. So it's a little different than it used to be, where you just showed up at the doc's office and say, take care of me. Now you're an active participant in this. So, and I think when you look at this, what are the resistance things when you guys don't do your exercises, or I don't do my workout today, Dr. Saleh doesn't do his workout today, Evan Davis doesn't run. There's a lot of things that we can kind of think about, and if you cognitively think about this and put this in your mind, it kind of makes it a little more sense, and you have to hold yourself a little more accountable. So one is your internal motivation. One is your reality check. What kind of shape am I in right now? You know, we all used to be great athletes here. None of us are great athletes anymore. We're all just trying to get by, so don't tell me how you used to run a this or do that or this. Live right now. Where are you right now in the present? So you got to kind of say, well, I'm not getting around too well. I can't walk very far. Everything hurts, or I can't straighten out. My knees don't work, or whatever it is. But do a reality check. And then you have to kind of get a little specific on what you're going to do. You can't just say, oh, I'm going to start exercising. What does that mean? Well, what you need to do is come up with a plan. So you need to start thinking, how am I going to do this? Am I going to get a physical therapist? Am I going to get some tapes? Am I going to come to things like this and try to figure it out? Am I going to go join the Y? Any of those are fine, whichever one works for you. And, you know, you may like going to the Y. Some people like going to the Y. It's very healthy. There's a lot of little kids around. People are running around having fun. You may like doing it in the privacy of your own basement. Your body doesn't know the difference. Your muscles don't know the difference. All they know is they either get worked out or they didn't get worked out. So start thinking about that. You may want to do it with a group. You may be better having a little peer pressure. And I can guarantee you this one, the bottom one, is 100% true. You will have to adapt to what you do. You will have to adjust. Everybody in this room has weak links. We've got bad knees, bad hips, bad backs, bad whatever. We've had this or that problem. So we all have some issues to deal with, which you have to learn to work around. And that's just part of the deal now. So again, that's kind of the reality check. You know, I can't run as fast as I used to. So when you start thinking about this, look at these kind of 7 things. I think probably the key thing is that you begin to plan, you begin to write down what you're going to do and why you're going to do it. So I got a couple of these, and this is from a book. It's called Fitness Over 40, and I'd write that down because that's a really great book. It's about 10, 11 bucks on Amazon. It's written by a gal named Vonda Wright. She's an orthopedic surgeon out at the University of Pittsburgh. She kind of goes through the basics of how to stay in shape. But we all gripe and complain that we deteriorate as we age, and we do. But really, if you begin to look at the deterioration, it's really about at age 75 that you begin to see it. So if you're 60 like me, I can't gripe too much. You get to be 75, then you begin to deteriorate a little more rapidly. But really, up until 75, most of it is disuse. Most of it is not doing stuff. Most of it is not being active, not stretching, not working on stuff. Once you get 75, then you can start saying, okay, I am getting older, and stuff doesn't work quite as well. So this is what women look like. This is both aerobic and aerobic, so this is muscle strength and also endurance. And the men, pretty much the same. Same curve. About 70, 75 is when things start deteriorating a little bit more rapidly. So up until then, it's only about 1% a year as a gross rule that we deteriorate. And this, anybody know who this is? This is Gary Player, famous golfer. I think he's 79. Looks pretty good, doesn't he? So all that deterioration at 75, he's not listening to it. So what I would concentrate on if I was you guys, I would think about this face. And this is what you got to work on if you're going to work on stuff. You just don't go out and walk every day. That's not going to cut it. You don't go lift weights every day. That's not going to cut it. You have to do all these. You have to work on your flexibility. You have to work on your aerobic capacity, or your ability to walk a distance, keep your heart rate down, get your breathing right. Carry a load, your strength. So you need to work on some strength. We get older, we get weaker. And you want to work on your equilibrium or balance. I mean, we all, as we get older, don't stand up quite as well as we used to, and we get a little dizzy. You can affect a change in that. Each one of these you can affect a change in. Flexibility is key. Everybody hates working on their flexibility. They kind of, I'm guilty as well. We all tend to kind of neglect that one. But what it is lengthening your muscles, lengthening your tendons. It affects all of us. As we get older, it affects us a little bit more, but you can elicit a change. If you stretch, your muscle, your tendons will get longer. Aerobic activity. Probably ought to look at something, doesn't matter what it is, riding a bike, doing an elliptical, taking a walk, maybe just working in the yard vigorously for 30 minutes a day. And this is a great quote. Those who think they have no time for bodily exercise will sooner or later have to find time for illness. So the point is, it's kind of that first slide. If you stay active, you stay busy, you're probably going to be sick less. Oh, no. Arnold didn't show up. I got a picture of Arnold Schwarzenegger here. Carrying a load, building up muscles. So it's vital for fitness after 40. We do begin to lose muscle mass as we age. Now, if you lift weights, you can maintain that pretty darn well. But a lot of us don't, and that's one of the things a lot of us don't do. We don't lift a lot of weights. We don't lift a lot of loads. So that's something to work on. It is reversible, so if you work on it, you will get stronger. Most of you need to work on low repetition, or high repetition and low weight. You don't want to try and bench press 5,000 pounds. You want easy weights that are easily manipulated, that you can handle nicely. Oh, there he is. So this is Arnold. He changed a little bit on us, didn't he? So Arnold has to live in the present as well. And equilibrium and balance, that's a lot of different stuff working together. You know, you may say, well, how can I do this? And you can't. Is it that I'm strong? Maybe. Is it I have good balance? Maybe. It's everything all working together. So you can do all that. You can work on this while you're brushing your teeth in your morning. You know, you're standing there, you can move back and forth on one leg. You can have your wife toss you something, your husband toss you something. You can do that all the time, but working on your balance is key because we do lose that as we get older. Oops. So what is degenerative arthritis? You know, all of us are having that. All of us will get that. Every one of us has some degree of degenerative arthritis. It has a lot to do with a lot of things. But basically, it's arthritis is caused by inflammation, breakdown, and eventually loss of cartilage. Cartilage is that white, pearly stuff on the end of the chicken bone. You scrape it off, you'll get the bone underneath it, but you'll notice it doesn't have any blood supply. There's no blood in that white cartilage. It peels off kind of like a pearl. Well, it can't heal itself. So we all get degenerative arthritis. You gals get it a little sooner than us guys. And it does get worse. It is not going to get better. All the king's horses and all the king's men are not going to make it get better. So it does progress. Every one of us is going to be a little worse joint-wise than we are right now next year. And it even happens to the great Tiger Woods. So a lot of you probably have knees. Knees are a little more common than hips. But all of us end up sooner or later getting this. This is what it kind of looks like when you do a knee replacement. Kind of look over here, you can see this is kind of somewhat normal cartilage. This is where the cartilage is totally worn out, and that's an area of kind of smoothed off like a rock in a creek bone. And that's caused by our age, our genetics, how good a cartilage did you get, how good was your rubber, big trauma, getting in a car wreck, motorcycle wreck, micro trauma, continually repetitive activity, some alignment problems. If you're real bow-legged or you're real crooked, you put a little extra pressure on your joints. So there's a lot of things that go into it. We're all going to get it. We all get it at different rates. And, you know, over the years, you know, this is total knees, total hips have done the same thing, but there's been a lot of progress. This is what I put in back when I was a resident, back in the late 70s. The knees have slowly, progressively gotten better. Now we have some gizmos and things we can put them in, whether it's the computer or the fancy cutting blocks. But things are markedly advanced to where they were. And a number of other things have gotten better. The anesthesia people have gotten much better. Some of the drugs we use have gotten better to stop the bleeding. The blood thinners have gotten better. So everything along the way has gotten better, except for you guys. People are sicker that get total joints now. They have more diabetes, they're heavier, they have more comorbidities or associated illnesses than they ever have before. So, while a lot of stuff's getting better, the people we do it on, I mean, I've done somebody 91 a couple of months ago, and made me nervous, but she did better than most. So my guess is if you make it to 91 and you're still around and can talk me into it, then God bless you, we'll go ahead and do it. So what are you looking for when you get a joint replacement? You want to get your mobility back, that's the main thing. Get your life back, get your activity back, get your whatever you like to do, whether it's gardening, walking, or playing with your grandkids, doesn't matter. Whatever it is you want to do again, and it basically gives you some freedom. So, these are my little things. Your result, I think it's going to depend a lot on you guys. So look at yourself as an equal partner in this. It's your body. Help it. Physical therapy is very helpful. They do a very good job. But ultimately, it's going to be you that are going to have to do those exercises and get that knee, that hip, that movement. So again, it's yours, and you've got to be a participant. You're an active participant in this deal. You're not just passively going through this. You've got to be actively engaged in this. So before surgery, again, live in the present. Change may be good. It could be a matter of life and death. If you're not able to get up and you're not able to walk and you get a blood clot and you get a pulmonary embolism, then you could just drop dead. So the quicker you get up and walk afterwards, the quicker you get up and start moving, the less your chance of complication, whether it's pneumonia, whether it's urinary troubles, whether it's your bowels, whether it's pain, or whether it's something very serious like a blood clot. Get in as good a shape as you can, because it can make a huge, 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 huge difference. So that's kind of my thing. You guys figuring it out that I think you need to get in good shape before you. So when you prevent complications, there's a lot of things we want you to do beforehand. We'd like to have your teeth tidied up. If you have any issues with your teeth, any cavities, fillings, things, get all that taken care of. If you have diabetes, we really want that under really good control. So the hemoglobin A1Cs need to be good. We'd like to have your weight down. We'd like to have your cardiac status stable and checked out and okay. And we'd like to have you getting in good shape. So living a little better, living a little nicer, eating a little better, doing healthy things. And I don't care what you do, just do something. You know, keep in mind the four things: the face, the flexibility, the aerobic, carrying a load, and your equilibrium. Keep all those in mind. I don't care if you swim, I don't care if you lift weights, I don't care if you walk daily. Just be active, do stuff, but you've got to make a change. And you kind of keep all those four things in mind. You do need to stretch out sometimes. You do need to lift some weights. You do need to take a walk.